Okay, so good evening. Before I begin, I would like to thank Aunty Rhonda for her beautiful welcome to country, and I would like to offer my own respects and acknowledgement to the traditional custodians of the land that I am joining you from, the sovereign Dharawal peoples. I would ask that all of you take a moment to recognise the people whose lands you are joining us from now. We are all joining each other here tonight from many different areas, but no matter where in Australia you are right now, you are on Indigenous land, which has never and will never be ceded. If you're following along on Twitter, here's the hashtag you can use and also my handle as well. My name is Ash Johnstone, a First Nations Dunghutti woman. 10 years ago, I was an academic with a fresh PhD and a frontline Indigenous domestic violence worker based at Women Illawarra. Today, I am still working as an academic, but now I am a professor in my university's Indigenous Research Department. As you all know, 10 years ago, the COVID pandemic led to a widespread disillusionment with how our political parties operate and with how we respond to emergencies as a society. Then, in 2022, in response to ongoing protests and a demand from the Australian people for real leadership and change, Australia became a world leader in Indigenous politics when it became mandatory for all Australian state premiers to operate as co-premiers, with one of the pair required to be a First Nations person. While difficult to implement in the beginning, this quickly led to a radical investment in funding First Nations people to become involved in politics at all levels, resulting in a significantly higher number of First Nations politicians at all levels of government, from town councils to the Senate. We now see that by having First Nations voices heard and represented in this way, there has been a dramatic shift in how our society responds to many different types of important issues, with significant improvement in many key areas. One of the most notable of these new policies and legislations is, of course, the Land Back movement, which has seen control of traditional homelands returned to First Nations people. We have also seen shifts in our global policies, our economy, and our education systems. However, while there are many, many policy changes we could discuss, I am here today to reflect specifically on the changes in how domestic, family, and sexual violence is now addressed in 2031. First and foremost, we now see community-led First Nations healing knowledge used to address domestic, family, and sexual violence. There are easily accessible Indigenous healing programs and community-controlled responses to domestic violence. By focusing on DV as a community health issue and seeking to address it in this way initially, we see less involvement overall of the criminal justice system. This has multiple benefits, including keeping people out of prison and reducing the trauma associated with going through this system. Any person experiencing domestic, family, or sexual violence is eligible to access emergency accommodation the same day they report needing help. This has dramatically reduced the amount of incidents being reported. These people are then able to be assessed for mid-term and long-term housing support, and within days are able to access suitable accommodation. We can see that the availability of housing has been one of the key areas of improvement for people experiencing domestic, family, and sexual violence. With the new housing legislation led by New South Wales' first Indigenous co-premier that demands that 1 in every 5 new building projects must also provide social housing, we can see a direct correlation between the availability of safe housing and the reduction in the number of people experiencing domestic, family, and sexual violence. While considered ambitious at the time of its proposal, the government eventually responded to the positive feedback from communities who advised that they consider social housing as important and something they want to see more of in their areas. As such, it was implemented with immediate success for reducing homelessness. All perpetrators of domestic, family, and sexual violence are able to enrol in community-run programs which seek to educate them on the impact of DV on their loved ones, as well as being provided with ongoing counselling. They are also supported to find appropriate housing and linked with employment and training programs, and where suitable, drug and alcohol programs. The rollout of targeted social marketing, such as advertisements during prime time on TV and radio, saw an increase in the number of self-referrals by people who commit domestic violence, and an increase in enrolment in these programs. Training of magistrates in domestic, family and sexual violence and new initiatives to direct perpetrators into these programs has also been received positively. We have seen an overhaul of our healthcare and Medicare system, notably a reduction in cost for health services and mandatory training in racism and discrimination for all healthcare professionals that must be renewed every 2 years. This has reduced reports of racism experienced when accessing health services. People are able to report racism within healthcare to an independent investigations body who take this very seriously. Unfortunately, as we all know, communities that experience a natural disaster soon see an increase in rates of domestic, family and sexual violence. However, it is hoped that with our new policies to reduce climate pollution and invest in sustainable energy, we will see not only that this will improve our economy, it will also reduce health issues, save lives, and reduce domestic, family, and sexual violence. Reflective of the fact that we are now experiencing the harmful effects of climate change on a day-to-day level, we also have policies to assist people living in climate-affected areas as a key priority. The highly successful land back movement has seen an increase in sustainable practices on lands that have been returned to First Nations people. We are seeing an investment into renewable energy, as well as fast and effective support for communities suffering from climate disasters. Unlike the terrible 2019 bushfire disaster, which saw community members still living in sheds 12 months later, we now have effective community responses which quickly and efficiently address the needs of those people impacted by climate disasters, such as fire and flood events. This has significantly reduced the amount of DV being reported after disasters. So to summarise my philosophy in regards to the last 10 years, I think that when we reflect on where we have been and what we have achieved, we see that as a society, we actually have the power to build for ourselves communities that work for us, that are safe and sustainable, that provide equal opportunities, and that support all of our people to achieve healthy and happy lives. I'm grateful to say that in 2031, I now live in a place that actively strives to never see a single person with no safe place to sleep, in a place that embraces First Nations knowledge, in a place that listens to advocates and experts. These kinds of changes did not happen overnight. They happened after years of tireless campaigning and advocacy from all of you. And I think that this is one of the most powerful messages that I would leave with you tonight, the power of the individual. Every single person here tonight has the power to be a true ally, not only in their own attitudes, but in their practices within the community services space. If your organisation does not engage with Indigenous people, it is your responsibility to question why not. If your project does not have Indigenous people informing and guiding you, it is your personal duty to ask why not. If your service does not have Indigenous workers, not just on the ground, but also in the boardroom and management teams, it is your responsibility to demand why not. Collaboration, community-led, sovereignty and self-determination are not just buzzwords used during NAIDOC and Reconciliation Week and then put away again. They are the cornerstones of achieving true equality. So if not you, then who? Thank you.